treating shoulders with stem cells or growth factors. Tell me about that.
Yeah.
Like, who's a candidate?
Yeah. So there are a lot of people that will have, shoulder pain as far as, being able to reach overhead or weakness, right? So even getting things out of the cabinet, working out, being at work, sleeping at night, that can be very tough for folks that have, rotator cuff tears in their shoulder. Maybe they have labral issues in there, or even, arthritis in their joint. And so using, stem cells, which are kind of like the bosses, the cells that can help, decrease pain, decrease inflammation, can be very helpful. Also using platelet-rich plasma, or PRP, which comes from your blood, can help those things as well. And then a fluid called prolotherapy can also help attract healing cells.
Now, you're not using, because going into this, I thought you were using like umbilical cord stem cells from babies, but you're actually using their own stem cells.
Yes, stem
cells.
Right? Yeah, stem cells from them. So either from their bone marrow, which is what we.
Is that a major operation?
No, it's a very simple process. It takes us about 35 minutes to do it. Very little pain, maybe 1-2.
Where do you get it from?
Get them from the back of the hip, the pelvis part.
Okay.
We, like I said, we give a little medication to help.
You just pull out the marrow.
And pull it out, yeah. And people do really well with
that.
that.
And then inject it right back in?
Well, we process it. We have a laboratory that's there in our office. And that's a, we don't have just a bedside centrifuge that a lot of places do. We actually count the cells. We look at the viability of those things, and once we do that, we then place it back in.
Okay. Is this true that a lot of people are saying that they're injecting stem cells into shoulders, but in fact they're just growth factors?
Correct. Yeah.
So there's a big difference.
Big difference, and especially if it's not coming from you and it's coming off the shelf, chances are it's not stem cells. It's going to be growth factors. Definitely can help. But that's a big problem. I mean, if you're going to have stem cells and pay for stem cells, then that's what you ought to have versus just growth factors. What we found with the research is that that these off the shelf, the umbilical things, the placental things, is that there may not be any live stem cells in there, or maybe not even viable. Right? Definitely, depending on the particular product that you have, could be some good growth factors that could help, but not stem cells. And we know that stem cells are definitely the most powerful regenerative tool that we have.
And do you have stories of people that had bad shoulders and now they're great? They're back.
Yeah. We definitely, from the weekend warrior to the business person or the person that goes to work every day to take care of their family, And
we should mention, because there's a lot of people injecting either PRP or stem cells in shoulders, and you say they're doing it blindly.
Right.
If you go to an orthopedic surgeon like you, you're actually looking at it through some sort of a imaging.
Right.
So you know exactly where you're putting the stuff.
Correct. So yeah, either we're going to use ultrasound or we're going to use fluoroscopy or like an X-ray. And not all orthopedic surgeons do that. We definitely do, because we feel that precision is very important. We want to get it into the area what needs to be focused on and treated. So that's very important for the way in which we do it.